Ghaith Prometric Questions and Answers, Part 4.
The nurse is assessing a child who has tetralogy of Fallot. Observe that the child is having clubbing in his fingernails. Which of the following might be the reason for this clubbing? A. Prolonged tissue hypoxia. B. Delayed physical growth. C. Inactive bone marrow. D. Pulmonary fibrosis. The answer is A. Prolonged tissue hypoxia. A 59-year-old woman is admitted in the medical ward for pyomyositis in her arms and legs. The muscular strength progressively decreased within 1 year. She has irregular breathing pattern and has difficulty in swallowing. Which of the following nursing diagnosis requires? A. Risk of choking due to disturbed swallowing. B. Weakness and fatigue due to lower muscle weakness. C. Disturbed breathing due to chest muscle. D. Disturbed activities of daily living. The answer is A. Risk of choking due to disturbed swallowing. A 9-year-old children, a high school girl who has fear of obesity, visited the primary health center with her mother and reports that her daughter refuses to eat with the family and often pretends being asleep. Which of the following disorder best describe? A. Bulimia. B. Obesity. C. Substance abuse. D. Anorexia nervosa. The answer is D. Anorexia nervosa. A 12-year-old child has been diagnosed with diabetes insipidus. Which of the following is affected by this disorder? A. Posterior pituitary. B. Adrenal medulla. C. Anterior pituitary. D. Adrenal cortex. The answer is A. Posterior pituitary. A patient returns to a clinic for a follow-up visit and is diagnosed as positive for human immunodeficiency virus or HIV. The patient expresses fear related to lack of finances, fear of social avoidance, and hopelessness. Which of the following nursing action should? A. Referral to physician infectious disease specialist. B. Referral to a community-based HIV clinic. C. Referral to the local public health department. C. Recommendation to disclose the diagnosis to the family. The answer is B. Referral to a community-based HIV clinic. While taking the history from a new patient, the nurse identified that he had hypomanic episodes, which has alternating with a mirror depressive episodes for the last 2 years. What is the most likely diagnosis? A. Bipolar 1 disorder. B. Bipolar 2 disorder. C. Dysthymic disorder. C. Cyclothymic disorder. The answer is D. Cyclothymic disorder. What are the symptoms of cyclothymic disorder? Symptoms may include any of the following periods: episodes of extreme happiness and high activity or energy, hypomanic symptoms, or low mood, activity, or energy depressive symptoms for at least 2 years, 1 or more years in children and adolescents. Cyclothymia, also called cyclothymic disorder, is a rare mood disorder. Cyclothymia causes emotional ups and downs, but they are not as extreme as those on bipolar 1 or 2 disorder. With cyclothymia, you experience periods when your mood noticeably shifts up and down from your baseline. A nurse calls together an interdisciplinary team with members from medicine, social services, and clergy, and nutritional services to care for a patient with a terminal illness. Which of the following types of care would be the team most likely be providing? A. Palliative. B. Curative. C. Respect. D. Preventive. The answer is A. Palliative. A nurse is assigned to care for a Muslim female emergency cesarean section. The patient is asked to wear a headscarf during the surgery. Which of the following is the most appropriate? A. Ask the patient to remove the scarf. B. Tell the patient that it is okay to wear the scarf. C. Ask the patient to wear a surgical cap. D. Tell the patient that a request will be during the surgery. The answer is C. Ask the patient to wear a surgical cap. A nurse is trying to secure a peripheral IV access in a traumatic patient who is deteriorating. The nurse has two failed attempts. What should the nurse do next? A. Activate code. B. Use introischius needle. C. Consider arterial line. D. Call another nurse who is more experienced. The answer is D. Call another nurse who is more experienced. A 70-year-old man presents to the clinic with difficulty sleeping at night. He has not had a good night rest for several months and feels exhausted. He needs to place 3 pillows behind his back in order to sleep. Examination of the lungs reveals crackles and wheals. Auscultations of the heart confirms an S gallop. Which of the following is the most likely underlying health problem? A. Asthma. B. Pulmonary stenosis. C. Right-sided heart failure. D. Left-sided heart failure. The answer is D. Left-sided heart failure. During CPR of an admitted patient in cardiac arrest, a family member asked the unit nurse to be at the bedside and say final words to their loved ones. The nurse explains to the family members that the scene is very disturbing and the medical team is doing its job. The family members still insist on witnessing the resuscitation. What would be the most appropriate action by the unit nurse? A. Allow family members to be at bedside. B. Wait and ask permission from the team leader. C. Call security to escort family members out. D. Refuse because there is not enough space in the room. The answer is B. Wait and ask permission from the team leader. A 33-year-old woman was admitted with ectopic pregnancy on the 6th gestational week. The patient has scheduled for resection of the involved fallopian tube with end-to-end anastomosis. Which of the initial nursing diagnoses for this patient? A. Grieving. B. Acute pain. C. Hyperthermia. D. Knowledge deficit. The answer is B. Acute pain. What is the most appropriate blood products for a patient with hemorrhage due to upper GI bleeding? A. Plasma. B. Whole blood. C. Packed RBC. D. Serum albumin. The answer is C. Packed red blood cells. A new community nurse in the rural clinic has to have good background about the health status of the community in order to assess their needs. What is the appropriate way to assess the health status of the community? A. Home visit. B. Community assembly. C. Mass information campaign. D. Community health assessments. The answer is A. Home visit. A nurse is caring for a child with traction of fractured bone. In the chart, a doctor had placed a reminder to maintain even and constant tractions. What would be the most likely understanding of the nurse for this order? A. Add or remove weights every other day. B. Allow weights to hang free continuously. C. Elevate head and foot of the bed alternately when in pain. D. Allow weights to hang free every 12 hours to achieve good circulations. The answer is B. Allow weights to hang free continuously. A patient complains of pain when standing upright, humped on the upper back. In the past year, slightly shorter. The doctor has suggested tests to what is the best appropriate intervention. A. Instruct the patient in the use of prescribed magnesium supplements. B. Have the patient sleep propped onto pain. C. Prepare the patient for a CT scan of both hips. D. Instruct the patient in the use of vitamins. The answer is C. Prepare the patient for a CT scan of both hips. A 56-year-old patient was diagnosed with instructions about administration of insulin, regular insulin, and neutral protamine Hagido subcutaneously every morning. Which of the following is right period for after administration in minutes? A. 10 to 15 minutes. B. 30 to 60 minutes. C. 60 to 90 minutes. D. 140 to 160 minutes. The answer is B. 30 to 60 minutes. In a post-operative patient in the surgical unit, most indicative of a developing complications: A. Increasing alertness. B. weak and rapid pulse. C. Negative Homan signs. D. Minimal bowel sounds in 4 quadrants. The answer is B. Weak and rapid pulse. A child was admitted to the hospital 3 hours ago with injury. The child responds appropriately but sluggish to drift in and out to sleep. Which of the following best describes this patient's level of A. Lethargy, B. Obtunded, C. Comatose, D. Semi-comatose? The answer is A. Lethargic. A nurse is planning to discharge a known HIV from the isolation unit after the recovery from upper respiratory infection. Which of the following nursing problem requires A. Risk of infection due to altered immune system, B. Fluid volume deficit due to frequent diarrhea, C. Anxiety due to disease, fear, and social, D. Weight loss due to higher metabolism rate? The answer is A. Risk of infection due to altered immune system. In people with advanced HIV, the infection may spread to the bloodstream, causing a severe infection called septicemia. Advanced HIV and AIDS can cause other medical conditions like kidney disease. A 60-year-old man client had a permanent complaints of chest pain and dyspnea with rapid, feels suffocated, and appears restless. The blood pressure is 100/70, the heart rate is 96, the respiratory rate is 32, temperature is 37. What is the immediate nursing intervention? A. Monitor and report findings of chest. B. Chest x-ray to identify dislocation. C. Manage pain with medication as ordered. D. Administer oxygen as ordered. The answer is D. Administer oxygen as ordered. A 28-year-old man and his wife involved in car accident in which wife was killed. The client is being monitored in the care unit for multiple rib fractures and a broken bones. Which room his wife is located? Which of the following is the most appropriate? A. Your wife is not in the hospital. B. I'm sorry, but your wife did not survive. C. I need to get your family so that you can see your wife. D. The doctor will be talking to you and explain to you about the situation of your wife. The answer is D. The doctor will be talking to you about the situation of your wife. Which of the following is the appropriate nursing advice to mother complaining of epigastric burning sensation and due use of drugs? A. Chewing gums. B. Increase fluid at bedtime. C. Drink orange juice on getting up. D. Eat small meals every 2 to 3 hours. The answer is D. Eat small meals every 2 to 3 hours. A 62-year-old female patient is admitted for her left eye cataract removal. She had cataract in both eyes with no visibility of her left eyes. She is scheduled for the surgery. What essential safety precautions must be assessed pre-operatively? A. Assess and document visual acuity of both eyes. B. Knowledge to prevent eye injury after surgery. C. Cleanliness of eye and removal of eyeglasses. The answer is A. Assess and document visual acuity of both eyes. A 46-year-old man is presented to emergency room with severe chest pain and unstable angina. The ECG of the patient shows ST segment depression on his 12 lead. A rhythm strip example of specific ECG changes. Which of the following cases the nurse determines ST depression? A. Injury. B. Necrosis. C. Ischemia. D. Nothing significance. The answer is C. Ischemia. A 35-year-old man with pulmonary edema is admitted to the intensive care unit. He is on mechanical ventilator without sedation. After the client is placed on the mechanical ventilator, the nurse diagnosed the case as impaired communication related to intubation and mechanical ventilation. What is the best method for the nurse to communicate with the patient? A. Use normal verbal communication. B. Communicate with the patient after mechanical ventilation removal. C. Use nonverbal communication such as head nodding and writing. The answer is C. Use nonverbal communication such as head nodding and writing. The nurse observes the client with CSF. Which of the following of CSF color indication for patient with bacterial meningitis? A. Cloudy. B. Clear. C. Red. D. Brown. The answer is A. Cloudy. The child has a third-degree burns of the hands, chest, face. Which nursing diagnosis takes priority? A. Ineffective airway clearance. B. Disturbed body image. C. Impaired urinary eliminations. D. Risk for infection. The answer is A. Ineffective airway clearance. A woman has polycystic ovary syndrome, which is 3 cm in size. What should the nurse do? A. Repeat the ultrasound after menstruation. B. Remove it by laparoscopy. C. Give the medication. D. None. The answer is A. Repeat the ultrasound after menstruation. Which of the following patient is the most appropriate to delegate to a new nurse? A. Patient on a strict bed rest. B. Patient for discharge teaching. C. Patient scheduled for an operation. D. Patient who is hooked to medical ventilator. The answer is A. Patient on strict bed rest. Factors affecting delegation. The acronym TAPE: teaching, assessment, planning, and evaluating. These are the RN tasks that cannot be delegated to the patient care assistants or new nurses. An 8-year-old girl is seen in the emergency department because of fracture in the right fibula, and she has a fiberglass cast on her leg instead of a plaster cast. Which of the following is an advantage to use a fiberglass cast? A. Cheaper. B. Dries rapidly. C. Smooth external. D. Shape closely to body parts. The answer is B. Dries rapidly. A 50-year-old man presents to the emergency department after having suffered a fall while practicing mountain biking. He appears confused and disoriented. His friend reports that he had been thrown over the handlebars and hit his head against the rock. The blood pressure is 108/66. Heart rate is 102. Respiratory is 22. Temperature is 37. Oxygen saturation is 99 room air. Which of initial intervention is the most important? A. Intravenous infusion. B. Oxygen administration. C. Cervical immobilization. D. Trendelenburg position. The answer is C. Cervical immobilization. A 24 weeks pregnant mother is in the antenatal clinic. She is upset and crying about having her third baby girl as her family wants a boy. She is requesting an abortion immediately before his family finds out about the sex of the baby. Which of the following is the most appropriate plan of the mother? A. Calm her down and reassure for an appropriate solution. B. Provide moral support and book her for procedure. C. Repeat ultrasound and wait for a few more weeks. D. Family counseling and follow religious guidance. The answer is A. Calm her down and reassure for an appropriate solution. A post-operative nurse assesses the newly formed stoma and skin of a patient who is 1 day post-operative following a proctocolectomy with the formation of permanent ileostomy. Which of the following clinical findings would necessitate immediate care? A. Bright red and moist stoma. B. Dark red and purple skin. C. Bloody liquid on pouch. D. Ulceration with a rash. The answer is B. Dark red and purple skin. A 45-year-old man is admitted to the surgical ward for stoma care. The stoma appears a dark red to purple color, is slightly swollen, and leaks a scant amount of blood. There is no presence of stool around it or on the site. Which observation requires immediate attention? A. Color. B. Edema. C. Absence of stool. The answer is A. Color. The signs of stoma problems or complications. The swelling does not decrease in the weeks following surgery or increases. Your stoma is having significant changes in size, color, The stomach is no longer beefy red or pink but pale in appearance. Your stomach turns dark red, purple, or even black in color. A nurse is taking care of a patient who underwent abdominal surgery 3 days ago. The patient has not been able to breathe deeply and cannot get out of bed since the surgery due to pain. Also, the patient explains of shortness of breath and the lung sounds are diminished on auscultation. The blood pressure is 120/70. The heart rate is 75. Respiratory is 22. Temperature is 36. The oxygen saturation is 89%. Which of the following conditions should the nurse suspect? A. Sepsis. B. Atelectasis. C. Congestive heart failure. D. Emphysema. Atelectasis is the collapse of a lung or part of the lung as known as the lobe. It happens when tiny air sacs within the lungs called alveoli lose air. Atelectasis is one of the most common breathing complications after surgery. What do the standards of pain management dictate the nurse to do? A. Avoid the use of the word pain. B. Screen for pain at each encounter. C. Discourage around-the-clock dosage of analgesics. D. Administer analgesics via injection whenever possible. The answer is B. Screen for pain at each encounter. What is the purpose of pain screening? Monitoring the pain to determine whether the underlying disease or disorder is improving or deteriorating and whether the pain treatment is working. A nurse is planning post-operative teaching for a patient undergone left partial mastectomy. On the third post-operative day, the nurse teaches the patient to elevate the arm above the heart several times per day. What does this exercise reduce? A. Pain. B. Infection. C. Hematoma. D. Lymphedema. The answer is D. Lymphedema. Why we elevate the hand after partial mastectomy? Raising the arm above the level of the heart when possible lets gravity to help drain the fluid. A conscious victim of a motor vehicular accident arrives at the emergency department. The patient is gasping for air, is extremely anxious, and has a deviated trachea. What diagnosis should the nurse anticipate? A. Pleural effusion. B. Tension pneumothorax. C. Pneumothorax. D. Cardiac tamponade. The answer is B. Tension pneumothorax. A 9-year-old child is admitted to pediatric ward diagnosed with glomerulonephritis. The mother asked the nurse why you should take the blood pressure frequently. Which of the following the nurse should be respond based on the knowledge? A. Acute hypertension must be anticipated and identified. B. Hypotension leading to sudden shock. C. Blood pressure fluctuates are a common side effects of therapy. D. Blood pressure fluctuations are a sign that the condition has become chronic. The answer is A. Acute hypertension must be anticipated and identified. Which of the following terms applies to the tiny, blanched, slightly raised, and arterioles found on the face, neck, arms, and chest during pregnancy? A. Epolis. B. Linea nigra. C. Stria gravidarum. D. Telangiectasias. The answer is D. Telangiectasias. Spider telangiectasias is a spider nevi or spider angiomas. Occur is about 2/3 of light complicated and 10% of dark complected pregnant women, primarily appearing on the face, neck, and arms. The condition is most common during the first and second trimester. During skin assessment of a patient, the nurse observed a skin described as rough, solid mass beneath the skin. Which of the following term is best to describe the lesion? A. Cyst. B. Papule. C. Pustule. D. Blister. The answer is A. Cyst. A patient who has pain localized in the chest, now down to the left arm. What is the type of pain called? A. Phantom. B. Regimented. C. Shooting. D. Radiating. The answer is D. Radiating. The nurse is preparing a patient for an insertion of central venous pressure line into a neck vein. The nurse should place the patient into which position? A. Side-lying position. B. Fowler's position. C. Trendelenburg position. D. Semifowler's position. The answer is C. Trendelenburg position. Neonate is admitted to the neonatal intensive care unit for observation with a diagnosis of probable meconium aspiration syndrome or MES. The neonate weighed 4.650 grams and is at 40 weeks of gestation. Which of the following would be the priority problem? A. Impaired skin integrity. B. Hyperglycemia. C. Risk for impaired parent-infant-child attachment. D. Impaired gas exchange. The answer is D. Impaired gas exchange. Which action a nurse needs to include when caring for a newborn receiving phototherapy? A. Expose all surfaces. B. Prevent stimulation. C. Cover the eyes with shield. D. Change position every 4 hours. The answer is C. Cover the eyes with shield. A patient with undergoing potassium infusion, he has burning sensation on the site of the infusion. What should the nurse do first? A. Stop infusion. B. Document as normal findings. C. Slow rate and call the doctor. D. Inform the doctor. The answer is A. Stop infusion. Treating pregnant woman diagnosed with syphilis is considered as A. Primary level of prevention. B. Secondary level of prevention. C. Tertiary level of prevention. The answer is B. Secondary level of prevention.